What I stopped doing was normalizing that fatigue was normal. And that's what women do. And that's what society does. Culture and society normalizes that brain fog is normal, that fatigue is normal, that loss of libido is normal. It's not. It's what happens. But you can be proactive and change it.
What is the most underrated longevity habit?
Protecting and building muscle. We've been taught to obsess over weight, but people don't understand that muscle is the currency of longevity.
Welcome back to another episode of Scrubs to Stilettos with me, Dr. Tiffany Moon.
And me, Dr. Nicole Martin.
We are so excited today. We have a special guest. Her name is Dr. Melinda Silva. She is a board-certified family medicine physician with over 25 years of clinical experience. And more importantly, she practices integrative and functional medicine. She has her own practice called Silva MD Anti-Aging and Wellness, and she takes a personalized, evidence-based approach to help patients age gracefully and stay strong. So we're so excited to have her on talking about a lot of modalities that we in our mid-40s can use to stay strong. We get a little bit into hormones and peptides, and we're just so excited to have her on. But before we do that, let's do our weekly obsession. What do you have?
So since we're talking about longevity and wellness, I am going to share my new favorite serum. I think, I'm not ready yet to start all of the injectable peptides. It's still a very new space for me, but I am very pro topical peptides, especially when it comes to your skin. And copper is one of these things you might hear people talking about, like the injectable copper peptide. I love this Exo Longevity Serum because it has topical copper peptide and exosomes. So exosomes are signaling molecules that send signals to your skin cells to regenerate, to make collagen, to restore your skin. And it has copper peptide, which is also really important in collagen synthesis. And I love the texture because some serums are really thick, like when you lay them on, they feel really heavy on your skin. This is really lightweight. It gets absorbed really quickly. So this has been part of my new nighttime routine. It's the Exo Elite Skin Longevity Serum with copper tripeptides.
Wait, that's new, right? Because I was like, I've never seen that because I thought I had the whole line.
No,
and I've never seen that.
We now have a longevity side.
Okay, I might have to.
I have to send you some.
Okay, so my weekly obsession. So for Easter, I don't know if I told you, but I bought my kids fertilized chicken eggs and an incubator.
Whoa.
And so I incubated them, and the incubator was not properly set, and so only one of the chicks hatched. There were 7 eggs, but only one hatched because the incubator wasn't set correctly, which is not my fault. It came like that. So we're going to do another batch. But this little guy or gal made it out of the 7. So she is a fighter, a miracle baby. So we're going to keep this chicken. My kids named it Chicken Nugget, which is not entirely appropriate. But I call him Cheep Cheep because he's very vocal. See, can you
hear him? That is the cutest thing ever. So where does he live? Is he inside your house? In a little
cage with bedding and water and food, and then we take him out and play with him, and he's super cuddly.
Oh my gosh, that is the cutest thing I've seen in a long time. And also, I love the idea of the science of it all, right?
Oh my God, I'm going to send you the link because they'll bring everything to your house with the eggs. And then at 2 weeks, they come and pick them up. So you can teach your kids about the whole thing. And it's like a science fair project. But then you don't have to keep the chickens. They pick them up and take them back to the farm. So,
I love that.
Yeah, I'll send you the link because they're all over the US.
Actually, a very, very cool thing to do. You know what? Now in the summer that they're not in school, this might be a fun little project.
Yes, it's super fun because, I'm basically like a science teacher. So we do things like that. So this is my weekly obsession.
Oh, so cute. Chicken nugget.
Well, welcome Dr. Melinda Silva.
Dr. Melinda Silva to the show.
Hi, Dr. Melinda. We are so glad to have you on Scrubs to Stilettos with us today.
I just love the name of your show, by the way, because I am known to like wear heels all the time. People know me wearing heels on the soccer fields as a soccer mom. Even with my scrubs, I wear heels. So I just have to say, I love the title of your show.
Oh, thank you. It's really an embodiment, right, of all the different roles that Tiff and I wear. You know, we're at the hospital saving lives one moment, but then we want to go to a fashion show or go shopping or get dressed up and go to dinner with our husbands. So I think it's really a testament to who we are. So
Yeah.
it's an easy name to decide on.
I tell people when they ask me, why are you always wearing heels? I say, that's my secret way to exercise during the day. Seriously. Because you have to contract your muscles to keep those heels.
Yeah, my calves are sore the next day. I'm like, I didn't even work out. Why am I sore?
Yeah.
We have a lot to get into, but before we get started, we have a few rapid fire questions that we would like to warm you up with. Are you ready?
Yes.
What is the most underrated longevity habit?
Protecting and building muscle. We've been taught to obsess over weight, but people don't understand that muscle is the currency of longevity.
Oh God, my friend Dr. Gabrielle Lyon would agree with you. She's like the
Yes.
muscle queen.
100%.
I am so happy that you are saying this, because if you actually look at my Instagram today, my morning post was exactly about this, how I've been monitoring my weight and my weight hasn't changed, but I recently had thyroid surgery and I haven't been able to work out for the last 6 weeks. So I monitor my body fat and muscle mass at home with a body analyzer.
Yes.
And in 6 weeks of not going to the gym, my muscle mass took a toll already. Like, you could see the drop in muscle mass and you can see the increase in body fat, but my weight never changed. So if people are just focused on a particular number, they have no idea what's happening in terms of body composition. Like, it's so important to look at actual muscle mass, because as we age, it starts to decline every decade. So if you don't work to keep it, you're going to lose it.
Right. It has to be very intentional and very proactive, because sarcopenia will happen if you don't do anything to preserve your muscle mass. And I tell people it's so important, because muscle is the strength that gives our body movement. Movement is medicine. Mobility is independence. And if people can't wrap their head around that, I've seen, unfortunately, patients who stop moving, like they're 70 years old and they stop moving, and then they literally can't move. It's just it's so distressing for me to see that, when it could be something that people can, be proactive about.
And I think there's this misconception when people hear you talk about muscle. We're not talking about everybody has to go lift hundreds of pounds and be a bodybuilder and have these big bulky arms or big bulky legs, but just having healthy muscle mass, because that's what surrounds your bones. It's what's going to support your skeleton. It's what's going to keep you, decrease your risk of fractures later on, to your point, keeping you moving, because as you get older, arthritis starts to kick in. So you want as much muscle mass so that you can stay active. I think that's the misconception when you hear people talk about muscle, that you're talking about putting on massive muscles like a bodybuilder, but that's not even it.
And you know what people don't recognize that I realize is that muscle is an endocrine organ that directly communicates with the brain. And when you exercise, you increase the BDNF, that the brain-derived neurotropic factor, that will actually create neuroplasticity and help us with focus and memory. So there have been studies to show with high intensity, like the HIIT exercise, for example, that will help with improving dementia more than medication. So people don't understand it goes beyond just the functional strength. It's actually critical for our brain. And so that's why I just really do not want to understate the importance of muscle.
That's a very good point you make. And also, I think people sometimes don't even focus on the metabolic impacts, right, that muscle has. The more muscle mass you have, the greater drive for your metabolism, right? So it's not just appearance that is important or that muscle contributes to. To your point, it contributes to cognitive function. It's almost like an endocrine organ.
It is an endocrine organ. It's affecting insulin sensitivity. And the insulin resistance is one of the main causes of why women stay fluffy during menopause. And I know we're going to talk about that. But if we can realize, like you just said, you noticed your body composition shift after surgery. When people are inactive and you have less muscle mass, what is going to increase in your body? That's the fat mass. The fat mass increases the visceral fat, which increases your risk of diabetes and heart disease. And that is the number one killer for both men and women. I know women are afraid of breast cancer or cancer, but if you take all of the cancers and you put them in one bucket, women will still die 7 times the rate of heart disease. So you have to really understand the importance of being proactive and reducing that risk by having more lean muscle, importantly, as we age. That's just, I live that. So that's why I'm such a proponent of it.
Well, that was a very long rapid fire. We usually do these short questions, but I love this conversation. Okay. Tiffany and I are both in our early 40s, so we're starting to think about this, perimenopause. It's becoming something that we talk about more. So I think both Tiff and I are very passionate about this, and I am a big proponent of exercise and muscle mass, so I could talk about this for hours. But let's move on to our second rapid fire, and then we'll dive back into all this later on. There are so many supplements on the market. I mean, rows and rows when you go to Whole Foods and whatnot. What is one supplement or your top 3 supplements that you love?
My favorite is vitamin D. First of all, it's not really a vitamin. It's really a hormone. It's a prohormone. And for some reason, they never changed the nomenclature. And in San Diego, even though this is San Diego, right? Almost everyone is vitamin D deficient. And the reason why this is important is because it's an immune regulator. It's an immune modulator. It helps us with our muscle metabolism, our bone health, but it also helps with our brain health. And it also helps keep our immune system stronger. That's why COVID receptors don't stick when vitamin D is above 60. And that's why vitamin D is in all the COVID protocols, because it helps with your immune system. And if I can get your vitamin D over 60, okay, women, your vitamin D will prevent the level being over 60, 50% reduction of breast cancer and colon cancer. It's also protective for men with prostate cancer and colon cancer as well. So vitamin D is my favorite. It's the first supplement I ever sold in my practice.
It's funny. I'm in South Florida, which is another very sunny place. And people think, I don't need vitamin D because I'm always outside and I drink coffee and I have milk. Every single time I do my blood work, I am low in vitamin D.
I know, it's
every
crazy.
Single time. And I eat a pretty well-balanced diet. I spend a lot of time outside with my children. And even then, I still am low in vitamin D. So I always do the 4 prescription strength tablets that you take kind of 1 week apart. And then it boosts me up for a little bit until a year later when I need to do it again.
Yeah. So you should just take it. I tell people, just take it consistently.
That's you know what? I'm going to do it. I'm going to add it to my pill box. There's enough stuff in there already. Just add one more.
I can't fit any more pills into my daily pill box. I need a bigger case because all these pills are ginormous.
Separate them.
Yes. Okay. What is one thing that every woman should start doing today?
I think that self-care is the best care. And I feel like you need to invest in yourself. And self-care can be different for everyone, right? That could be spending more time with your children, spending more time with your dog. It could be meditation. It could be getting that facial or that massage that you've been wanting. But I always tell women, when you're better and you show up for yourself, you're going to be better for everyone else.
Amen to that.
Amen to that. So listen up, listeners. This is, if you needed permission, Tiffany, myself, and Dr. Melinda are giving it to you because you cannot pour from an empty cup. I love that saying because if you are depleted, you can't show up for anyone else.
That's exactly right.
Make sure you guys are taking care of yourself.
Mhm.
So, Dr. Melinda, how did you get into this space? You've treated patients for decades. You've had, as you mentioned or alluded to, you had your own midlife experiences that kind of shifted everything for you. Tell us what happened at this point. What were you going through mentally, physically, emotionally at the time?
It was a period of my time when I'm very busy as a doctor. I was a family doctor in a very busy HMO setting. And I loved medicine, but I didn't love the practice of medicine at the time. And I know you two can relate to this. And there was physiological changes in my body that hijacked me and made me unrecognizable to myself. And the breaking point, right? I had changes that my hair was falling. My hair is stronger now and better. This is my own hair.
You have
I
beautiful
was losing
hair.
my hair, and I was having thin hair here when I was about 46, 47. I'm going to be 63, in a couple of weeks. And I'm telling you, balanced hormones, we're going to talk about that, but I will tell you.
If you guys, sorry to interrupt, if you're listening on Apple Podcasts or Spotify and you can't see us, you need to go to our YouTube channel and check out Dr. Melinda, because she's a hottie. And when she said she was 62, you should have seen tiffs in my face. Like, it fell to the floor because I didn't know how old you were.
Yes.
I never would have guessed 62.
I say this, and I say it proudly because, my mom lies about my age so she can lie about her age, right? That's a traditional Filipino mom. But I say this because, Dr. Tiffany, Dr. Nicole, I want people to look at what someone should look like over 60. I want to change that paradigm. I want to shift that focus. My kids tease me. I have 4 kids. They're like, "Oh, Mom, you're such a boomer." But I want people to embrace that you could be unapologetic about looking good. Women are they don't take care of themselves because for decades they've taken care of other people. I was in a stage in my life where I was having hormonal changes. I was not sleeping well. I had brain fog. I was getting fluffy, like fat around the middle without doing anything different. And it was so frustrating. And when I went to go see my primary care doctor, their answer for me was Prozac and birth control pills. And at the time, I thought to myself, well, Melinda, that's what we do. But somehow I thought it was going to be different for me. I really did. I was just thinking, oh, wow, they're going to have something. And so I was really on a quest for self-care, a quest because it wasn't going to be good enough for me to do what traditional medicine wanted me to do. I knew that that's what they wanted me to do, but that's not what I wanted to do. And the breaking point was that my teenage son was going through hormonal changes too. So we were like this.
Butting heads, a recipe for disaster.
Yes. And he said to me, and it was like a slap in my face, I tell you, I was so hurt because he said to me, "Who are you? And what did you do to my mom?" And it just, I still get chills when I think about it because it just hit me to my core because you don't understand. I lived to be a mother. I wanted to be a mother more than anything else, more than a doctor, more than anything. And for him to say that to me, he knew that I wasn't myself. And my husband, who was so supportive, it means so much to have someone that's supportive in your life. And he said, do what you need to do to get yourself back. We'll be here for you. Mm-hmm. And it was that permission. I've been with my husband for 38 years. Okay. So he was my anatomy lab partner. He's my anatomy lab partner.
So cute.
He works with me now. He works with me now. So you can imagine, this is, we're a power couple and I'm so proud of him because he left mainstream medicine and he joined my practice. But he realized that unless I was comfortable in my own skin and I was comfortable with myself, that I wasn't going to be the mother that he knew that I wanted to be. My kids deserve better. My husband deserved better. I just wasn't myself. And so on this quest to find myself again is when I found out about the bioidentical hormone therapy. And I was an early adopter to that. I did that about 15 years ago when nobody else was doing it. And I did a cash only practice that nobody else was doing either, especially in San Diego. So I just, but I realized that I could do it better. I could do medicine better. And I saw the future Now menopause, treating menopause is trendy. But you know what? Come on, Dr. Tiffany, Dr. Nicole, they don't know how to do it because we didn't learn about menopause in medical school, and I'll tell you why. In medical school, we learned about disease processes, right? You learn a disease, you were given a prescription drug to fix that disease process or to fix the symptoms, a Band-Aid. But what menopause is a transition of life. It's not a disease process. So doctors suck at treating it. We didn't learn about it. So now it's trendy because thank God, I mean, I fell to my knees last fall when the FDA, Dr. Marty Makary, removed the black box warning that hormones cause cancer. I knew it wasn't ever true. I've been fighting that for 15 years. But for him to actually say it out loud and say it was one of the biggest mistakes of modern medicine to make women believe, a whole generation and doctors believe that the hormones cause cancer, to put that fear and then say that it was not true. I just felt so liberated. I can't even tell you. I was so happy. So I felt like my work is easier now, but there's still a lot of work to be done because unfortunately there are people who are just trying to treat menopause, but they don't know how to treat it well. I've been doing this for 15 years. This is my specialty. And the thing that gives me the most credibility, you know what it is that I lived it. Girls, I lived it. I was like, I wanted to be better. And, for my family, for my patients, because when you're better, when you show up for yourself, you're a better mother, doctor, friend, daughter, sister, whatever it is, whatever role you have in your life. And to me, that's what I need. I needed to get myself back and get my hair back. I was losing my hair, but look, I have all my hair. I mean, it's crazy. As we get older, we're supposed
paint us
to
a picture, Dr. Melinda. You said you started feeling like you were going through menopause in your late
46.
40s, 46, 47,
Yeah.
and you felt hijacked. You were all over the place with your emotions and energy was on the floor. What changed? What did you do and how did it change after hormone therapy?
What you have to understand is that small and consistent practices change your physiology, your emotional resilience, right? Like I got my resilience back. When you have hormone depletion, you just have enough hormones to do what you need to do to get by. And what I stopped doing was normalizing that fatigue was normal. And that's what women do. And that's what society does. Culture and society normalizes that brain fog is normal, that fatigue is normal, that loss of libido is normal. It's not. It's what happens. But you can be proactive and change it. And for me, it just wasn't good enough for me just to be existing. I wanted to thrive. I wanted to stay stronger. Okay, so you know that I started bodybuilding when I was 57. And I will tell you before that, I never lifted weights, okay? And I became a master's fitness champion. But it was because I realized the strength of my body, the power of my body. And actually what initially started me on this road was that I had lost my father and I had a void in my life. And my friend who was a trainer said, "What's wrong with you? Who are you? You're not yourself." And it was because this void that I felt that I never had. And he said, "We're going to focus on the strength of your body to get out of your emotional despair." And ladies, it worked. I was able to focus on what I could do with my body and push myself to places that I never thought I could. But I needed a trainer because I have arthritis everywhere, right? And, and I tell people I use all the tools in my toolbox. I needed the technology, right? I used Emsculpt Neo because I can't physically do sit-ups because I had arthritis in my back. And using technology to help build my core muscles, guess what? It helped me to be stronger and then keep exercising. Right? So you have to use the technology that's available to you to help you. but it's just something to get you started. You need to do the hard work afterwards to keep it going, right? So I do restorative yoga and Pilates and restorative exercise. And I will tell you, for anyone that's listening out there, I was not the athletic one or the pretty one. I was the nerdy one, the smart one, right? So, and I knew that I needed to be smarter, outsmart my body, because my body wanted to age and get weak and have sarcopenia set in. And I wasn't going to let it happen. But there was a lot of things that I had to do, starting with foundational health, which meant having good sleep. You know, you guys went to medical school. We were trained that it's okay to get, burn the candles on both ends. When I did integrative functional medicine and I actually practiced what I preached, I had to change everything in my lifestyle. I had to change everything and throw out everything out the window about what it was to be strong and healthy. And one of those things was getting foundational sleep and understanding that what you put in your body, the food is information for your body to function, right? And people have to change how they treat their body and what they put in their food and the habits that they have that can keep them strong. Because I told my husband, it takes a lot of effort to stay cute, right?
I know.
You got to do so much. But you can, but you just have to be consistent. And I knew that once I had that recipe, but there's, it's a lot of things. It's not just one thing.
You mentioned Emsculpt Neo. Some of our listeners might not be familiar with it, or maybe they've heard it, but they don't really understand how it works. Can you tell us, like in plain terms, what Emsculpt Neo is and what it's intended to do?
Well, what the Emsculpt Neo is high focus electromagnetic energy that increases contractions in your, like, for example, if you put on your abdomen, these super maximal contractions, more than what you can do voluntarily. And what it has been shown clinically to do is actually reduce visceral fat. So it decreases fat and build muscle at the same time. And this machine does not hurt. There's no downtime. And it's been clinically shown with MRI studies to work, to be effective. You to know that the best treatment in medicine is one that has high benefit and low risk. And that's what this machine is. And these super maximal contractions actually been shown histologically to increase or cause hypertrophy of the muscle. Remember, the muscle is an endocrine organ. That will decrease visceral fat and reduce insulin resistance. So it's helping your body at a metabolic level. And that's what one of my favorite reasons to use it is to decrease visceral fat. How many modalities will decrease visceral fat? And this builds muscle at the same time. So it's really helpful for patients that are on GLP, right? And they lose a lot of muscle because of the fast weight loss. The Emsculpt Neo has been instrumental and transformational for those patients. There was a study that was done recently that showed that with the Emsculpt Neo, in addition to the GLP, there was a net muscle gain instead of a net muscle loss that you would see with the GLP. And the other great reason I love it is that it helped with my back pain. Because remember, I told you I have arthritis. Not only did it give me like strong abs, but my back pain lessened. And there's a modality on it for wellness that helps with decreasing inflammation at the level of the muscle fibers and actually decreasing pain. So I love that we have this functional capability in an aesthetic tool, right? The machine was meant to build abs, but at the same time, it's helping you at a metabolic level. So it's helping you with your health and with wellness. And for me, it's like, why not use it? Use what you can in your toolbox to get you ahead. But keep making those choices in life to keep it, right? You're not going to do Emsculpt Neo forever. You're using it to help you to get strong, but then you have to make those proactive changes to sustain it. And that's what I can't stress that enough. You have to be proactive if you want to stay strong.
So funny enough, I actually did 4 sessions of Emsculpt Neo recently because like I mentioned, I was out of commission. I couldn't do weight training, which I normally do because of my surgery. So for 6 weeks, I was kind of just sitting around, probably eating more junk food than I normally would because I was like on bed rest, quote unquote. And I started to feel a little bit pudgy, you know, my fat started to go up, my muscle mass started to go down. And one day I was surfing through Instagram and I saw someone talking about Emsculpt Neo. So I started doing a little bit more research and I was like, to build muscle, reduce fat, no needles, no downtime, no heavy lifting. It was like exactly what I needed for those weeks when I couldn't do stuff. It was so easy. I went into the office, they put the little paddles on you, it doesn't hurt, they titrate up the energy level to a point where you can tolerate it, but you feel the contractions. Like your whole abs are like, bzz, bzz, and you feel it. It's like if you're doing sit-ups. And 30 minutes is the equivalent of, if I'm not mistaken, if I remember correctly, 20,000 contractions.
More than 20,000 more than maximal contractions that you couldn't do voluntarily. And one of my favorite patients that it helps are women and men that have the diastasis recti, you know how the muscles separate. The Emsculpt Neo has been the one non-invasive, non-surgical modality to bring the muscles back together. So, I mean, it's just amazing. And it's almost like Star Trek-y, like, is this going to work? But it actually does.
You feel it. You literally feel all the ab muscles. Yeah. It's almost like a corset, like squeezing together. And then you feel it relaxing. And the first 2 times I did it, the next day I was a little sore.
Yeah,
I was
because you feel it.
Yeah, it felt like I had done a really hard workout, but obviously I couldn't lift anything because I was recovering. So like you said, I think it's a great transitional tool, to kind of like a stepping stone, but you have to make changes. Like now I'm cleared, I'm back at the gym and whatnot. But I thought it was an incredible experience, and I saw the difference after my 4 sessions.
And my favorite patient that I put it on, I mean, it makes me tear up when I think about it, was a paraplegic who was trying to get back into physical therapy so that one day that she could walk again. I put the Emsculpt Neo on her abs, and she said, "Doctor, this is the first time in 16 years that I felt my ab muscles." And I started to cry. I didn't even charge her. I mean, I was like, oh my God, I can't even believe that this works for you. And then so she had a physical therapy session the next day, and the physical therapist called me. She said, "I don't know what you did, but the patient is stronger, and she got more out of her physical therapy session than she ever did." And so this is why I'm saying to you that, use the tools that are available to help you, right? Take advantage of those, but recognize that you still have to do the work, right? I mean,
have you ever tried this, Tiffany? Have you ever tried it?
I did my glutes instead of my abs.
I love the glutes, girl. That works.
I haven't done that one.
Oh, I love that, and that helps you with back pain as well.
Pick one or the other, and I was like, would I rather have a 6-pack or like a juicy peach? And I was like, okay, these days, I don't really, be showing my abs. And I was like, but I want a cute butt, because you can see your butt in dresses and all that stuff. And being from a Asian descent, I was not blessed with a cute booty. You know what I mean? So I did 6 sessions on my glutes, 1 week or maybe 10 days apart or whatever. And the first 2 times, I didn't really feel anything. And then it was weird. The 3rd and 4th time, I was like, oh my gosh, I'm really sore. And then I started to see a little bit more shape to my glutes, but it was subtle, right? It's not like filler where you inject your face and it's filled.
Right.
It was after the 3rd week, after the 4th week, I would look in the mirror when I was in my yoga pants and be like, I think my butt is cuter and more lifted.
Yeah. And you know what it will do for you as well is that it will make you stronger like when you do squats or when you do any kind of leg exercises, you're going to feel your strength. And that's what's amazing about it, because that's what's going to give you the most benefit, is keeping it up, right? I wish you guys were closer to
I
me.
haven't been keeping it up.
Yeah, I mean, I wish you guys were closer. I let you use it.
I would go hang out with you all the
it.
time. I love all this sorts of things.
Oh.
I mean, the technology really is fascinating. And when you think about, you know, how muscle contraction and muscle growth works, it makes sense. And it's not just limited to your abs or your glutes. I mean, they're using this technology to help with pelvic floor strengthening. They also have the Emsella device. Have you ever? That? So funny enough, I have a girlfriend who owns a med spa here in Miami, and she has it in her office, like as, you know, a tool for her that she offers to her patients. So when she got it, I was like, can I try it? And so she let me try it for a session. I had C-sections and my children were pretty small. So my pelvic floor, and I did pelvic rehab, so my pelvic floor is pretty good, but I wanted to try it. And it's fascinating because you sit on the chair and you feel the, like electrical or the sensation, like in your perineum area, and you feel the, like, it's almost like an unintentional Kegel. You feel the pelvic floor tighten and lift. Like you feel the raise in your pelvic floor when you sit on it. So I think it's also great for patients that are struggling with pelvic floor issues. I mean, I'm sure Dr. Melinda can tell our listeners more about it.
Well, the Emsella uses similar technology as the Emsculpt Neo, where there's focused electromagnetic energy that's stimulating thousands of deep pelvic floor contractions. So it's like pelvic floor muscles that you wouldn't be able to activate on your own, like Kegel exercises. But a 30-minute session will be equivalent to about 11,000 Kegel exercises.
Wow.
And this is having strong pelvic floor muscles means having stronger ab muscles. But if you ever ask a guy to do a Kegel exercise, he'll look at you like, what the heck is that? They've never done a Kegel in their life. It's hard to voluntarily contract those muscles. And remember, ladies, so the pelvic floor gets stronger. So the bladder angle changes and it helps with incontinence, right? Which is something that is very like taboo to talk about, but very important because, again, with everybody taking GLP, I mean, everybody knows somebody taking GLP. The fast weight loss affects all muscles, including the pelvic floor. So what people are not talking about, but is happening, is that more people are leaking, more people are having incontinence issue or having to use the bathroom because of the weight loss. And it's not only for postpartum women, you know, even athletes. They say up to 1/4 of college athletes will have a stress incontinence. So guess what? They could sit on this machine, strengthen their pelvic floor, lift up their pelvic organs, and reduce their risk of incontinence. But you know what my favorite reason to use this is that, remember, a climax or orgasm is contraction of the pelvic wall. So with age and hormonal changes, those contractions get diminished. But guess what? With this machine, there's actually a setting for what they call sexual wellness, and it will help you have a better climax. I was talking to a guy, and I was, a gentleman about it, and he goes, "Doctor, you should have started there," because I was talking about incontinence, and everything. He's like, "What? Is it going to help me with?" "Oh, sign me up." And it's so easy because you're wearing your clothes, you're sitting down in this chair, and it's hitting what I call the perineum, which is the area between the vaginal or the scrotum, right? Vaginal opening or the scrotum and the rectal opening. That I call it that landing strip, that perineum. You're contracting those muscles with focused electromagnetic energy just by sitting in a chair, and you're wearing your clothes. You don't have to take off any clothes. You sit, you walk in, you walk out. It's so easy. But it's not awkward at all.
It's not like some of these devices, some things are intravaginal and whatnot, but not this. This is just a chair. Not. It looks like a regular chair. You sit on it with your clothes and it does its thing. It sends the high energy signals.
But my favorite patient this worked on, Dr. Tiffany, Dr. Nicole, and I still remember her so clearly because she was this like 85-year-old socialite. And she came into my office. I was helping her with balancing her hormones. And she didn't know that I could help her with her incontinence. And she said, you know what? I wear diapers and I'm afraid to say that. And I don't feel sexy. You know, who feels sexy in a diaper, right? And, you know, fun fact, there's more adult diapers sold in this country than baby diapers, just in case you didn't know that.
Really?
Yeah, a lot more adult diapers. Because remember, babies wear diapers for 2 or 3 years, but adults, if they start wearing diapers after 60 and they live to 90, they're wearing them for decades. So
That
this
was a fact I
patient,
didn't know.
yeah, and this patient, she was in her 80s and she was a socialite, and she came to me after she did her sessions in Emsella, and she says, "Doctor, I don't have to wear my diaper anymore." And you should have seen the poise in her body, the confidence in her, in herself. She says, and I feel like going out now, because usually she would have to depend on where she was going, was dependent on if there was a restroom nearby. So, because she didn't want to wear diapers when she was going out. So people don't understand how disabling it could be to be incontinent, because people don't really talk about it. But it happens with both men and women, and especially with patients that have, men that have a bigger prostate or they've had prostate surgery. And don't forget college athletes. So there's a lot of people that it can affect, but most doctors don't talk about it. And with everybody doing fast weight loss and the pelvic muscles relaxing, I mean, this is such an easy tool to use, and most people just don't know about it. So thank you for bringing that up and bringing it to people's attention, because it's so important.
So for the patient like that, would her treatment plan then be to do it every once in a while? Or do you do some and then if your problem is fixed, you're better? Or how do you maintain that efficacy?
So it's like anything else, right? Because it's increasing the strength of the pelvic wall. And so the clinically indicated treatment is 6. She needed 10 because she was older. And the older you are, the more treatments you needed. But now she does a treatment once every month or every 2 months. Some people might do once a quarter. Some people might do once every 6 months. It just really depends on how severe your incontinence is. But how amazing is it that you could do something that could fix a nuisance, a problem that affects so many people, that's non-surgical, non-invasive, and so easy. I mean, you've sat on the chair. You literally sit on the chair, you walk in, you walk out. I'll offer the treatment sometimes for my patients who are just waiting for me if I'm like 15 minutes late.
You're like, I'm running late, but sit on this chair.
Yeah, and they love it. They're like, hey, Dr. Silva, can I bring a glass of wine next time? I mean, They love it. It's awesome. Just because it stimulates down there, and it helps you like I said, it just helps with the sexual enhancement, and we all need that as we get older. Things just are less sensitized down there. So anything that we could do, and there's a lot of things that we have to do, right? There's anything that we can do to help with the receptor sensitization is important. And one of my favorite things, and I hope we get a chance to talk about it, is giving testosterone for women, because that helps, not only libido, but so many other things in a woman's life. And also a very underrated hormone for women.
Well, how do you know how much to get? Are you giving it topically, presumably, and then do you measure a blood testosterone level?
Always do. I always do. I always measure, because I'm a medical doctor, right? So I need objective evidence. Data. So I will get levels before they start hormone therapy and during the treatment process. I know in mainstream medicine, they don't even check hormone levels. They just start women on the same dose of progesterone and estrogen, and lucky if you even get any testosterone. But that's because, again, they're just not trained to give women testosterone. And it's not their fault. Doctors, it's not that they don't want to help you. They just don't know how, right? We didn't learn about menopause. I did a 2-year fellowship after being a doctor. a primary care doctor for 13 years, I did a 2-year fellowship, like a mini endocrine fellowship, to learn about hormone therapy, to learn about physiology of it and how to give it. So it's not like something, hopefully you're not going to someone that just took a weekend course and is trying to do this because people are trying to monetize on it because people are desperate. But please see somebody that's credentialed and knows, because there are a lot of nuances to it. And when women start getting side effects, like if you start a woman on too much testosterone, they're not going to not only like you, they're not going to trust you. Because women don't want to have acne or hair, and that's their fear, right? They're afraid that testosterone will masculinize them. Look at me. Do I look masculine? I don't have a mustache. I don't have acne, right? I have muscles, but they're toned. They're not bulky, right? They get confused with testosterone being like an anabolic hormone to build for men, for bodybuilding. That's not what we're doing. We're doing physiologic doses. Yeah. We're not doing super physiologic doses, but that's why it's important to get labs done. And unfortunately, a lot of doctors are they're not trained in it. And that's like my mission in right now while I'm still working, right? Because honestly, I could get Medicare, ladies. I could retire. But I just feel like not enough people know. So I'm trying to teach other doctors about it. And the other thing that happens with hormones, and you guys might know, and we could talk about it on another show because it's really, really important. But peptides are so in right now. But people are getting peptides from their gym trainer, right? They're not getting it from the doctor. And it's very dangerous. And they're buying things online that's sketchy. But the peptides can be another really, really great tool to augment and modulate hormone optimization. And again, that's another tool I have in my toolbox, right? So I'm happy because I'm like a biohacker and I have all these tools that I use.
I feel like we're going to have you back, Dr. Melinda, to do a deep dive into the peptide world.
I love talking about peptides. We need to talk about that because that people are doing them and they're not doing them safely. And
they're ordering them from China and the bottle says not for human use. And then you're injecting that into your body. And I'm like,
how are you going to inject that in your body when it says research use only?
But they do is what I'm telling you. They do.
Yeah, but that's what I mean, because people are desperate. But you don't have to be. There are FDA compliant sources for peptides, that those are the only ones that you should use. And I have access to those, so I can tell you what it is.
We need a whole nother Dr. Melinda peptide episode. But I did want to touch briefly on Exomind, which was the third modality that I tried. So I went into the office here. The one that I went to here was called Evolve Med Spa in Dallas, and they were so nice and so knowledgeable. They explained it all to me. So I did the Emsculpt. Then I did Emsella, and then she said, do you want to try Exomind? And I was like, what is that? Because I had never heard of it. And she said, well, it's supposed to help with brain fog. I told her that I have insomnia, at night. Even though I'm tired, I feel like I'm racing about all the things that I didn't get done or thinking about all the things I need to get tomorrow, and I can't quiet my brain. And she said that it would be good for that. And so I tried Exomind, and look, I don't know if it was placebo or not, right? But I feel like that week after I did it, I had better sleep scores on my Oura Ring than the week prior. Who knows, right?
It's not a coincidence. It's not. I will tell you, I was one of the 3 study sites last year that had IRB approval to study Exomind. So I was one of the first clinics to have it in the country. And it actually does help increase neuroplasticity, which means you have better focus and memory and sleep. And what it's doing is that it's using targeted magnetic therapy in a certain area of your brain, the left frontal dorsolateral cortex, which is responsible for the executive function and for concentration and for mood. And you know all these people, right, Dr. Nicole, Dr. Tiffany, not all these people all of a sudden had ADHD when they're adults, right? But we're treating them with Adderall. We're treating all these people with stimulants. but what they're having is brain fog. What they're having is brain fatigue. And what we need to do is stimulate those synapses and connect those connections so that we have more neurochemical passing through and building those connections. And that's what the Exomind does. It's targeted, safe, magnetic therapy. Again, it doesn't hurt. You just lie there, right? You did the treatment. You just lie there.
Did you feel anything, Tiffany, during the treatment? Is it like a tingling or anything?
No, I fell asleep.
Yes, I fell asleep.
Like I can't sleep at night, but I can fall asleep in the doctor's office. So
Yes.
I just lay down. No, it doesn't hurt at all. And it doesn't tingle. It's like kind of like it feels like someone's like tapping your head. Like a tapping thing.
It's magnetic stimulation. It's modified.
No, it's like, you have to like lay down in a certain position and they put it and she's like, okay, now don't move your head, you know? So yeah, I don't know. I'm not.
It's an open cap. It's a cap that rests on your forehead.
Okay.
And what it does is that this tapping sensation is targeted magnetic stimulation. So you've heard of transcranial magnetic stimulation, right? TMS? Mm-hmm. This is a modified 2.0 version of that. So it's the easier version. The older version, you have to wear these caps. It takes an hour to figure out the settings for the patient. It's very cumbersome. This treatment is an open cap that sits on the top of your head using these magnets that don't hurt, because the traditional TMS can hurt and cause pain and be a little bit scary for people. This one isn't anything like that. And you can fall asleep, like I fell asleep. But it's good to quiet the brain. That's my favorite reason to use it for people that have anxiety. I've used it on adolescents that don't want to or cannot tolerate antidepressants and anti-anxiety medicines. And, it doesn't have a black box warning on it, like it could, that it can increase suicide like the antidepressants do, right? It just helps quiet your brain. So I have a little, ADHD that I use to my advantage, right? But sometimes it can be a little bit too much, because that noise in your brain can reduce your efficiency and productivity, right? And it can keep you up at night. So when you have something that calms your brain, calms your system, then you're able to sleep better, you're able to think more clearly, you have better clarity, you have better concentration. I mean, it's amazing. And it's so easy. You just literally, it's like a 28-minute procedure. You just lying down still, and it's relaxing. Like I fell asleep too. And one of the first times that I did it, I had so much emotion because I was like so wound up with everything that was happening with some stressors, and the release of my emotion and anxiety and letting go of that, it just made me like tear up and relax. And it was like a very liberating feeling. So I love it for patients that have like that anxiety that really don't want to take like anti-anxiety medicines, or people that have issues with sleep. Our sleep study showed that over 82% of people had better sleep after doing only 6 sessions. I mean, it's amazing. You do the session once or twice a week for 6 times. And I've seen it demonstrably help people's sleep patterns. And again, it's like one of those machines that have high benefit and low risk.
For patients that are listening and, maybe have really bad anxiety, but don't like the way the medications make them feel, and they're thinking, oh, this might be a great alternative to that. How does insurance work? Does insurance ever cover any of these sessions? Like, I understand the Emsculpt maybe, because that's more of a cosmetic, but if you have documented stress incontinence or documented mental health, is this something that people could get covered by insurance?
I think that it is covered. The traditional TMS, transmagnetic stimulation, the traditional TMS is covered for depression, major depression, because that's what the FDA indication is for TMS. So it is covered for major depression. But the machine is totally different than the Exomind. The Exomind is TMS 2.0. It's not wearing the cap. It's not
Right, it's more
doing 40
comfortable, easier
treatments.
for the patient.
It's much more comfortable. So of course, like anything else in, medicine, the newer treatments, they're not
time.
right?
It's such a shame
There is a
because-
setting, though, I will tell you, I don't know how many offices does it. I don't focus on major depression because I have a wellness clinic, right? I think if you have major depression, you should be seen by a psychiatrist. But major depression is a setting on the Exomind, and you could have that covered if you're truly treating major depression. But those people need to have like 30, 40 treatments. Right?
Oh,
it's different than treating anxiety and treating stress and sleep.
Right.
That's what I'm focusing on in my clinic. Because
Yeah,
remember, I
there's
have a
the whole
wellness
wellness aspect of it, but then there's also this amazing like medical, medical application for clinical conditions.
Right.
So the technology is fascinating because it can really be used over a wide spectrum from wellness and longevity to managing medical conditions.
No, it's amazing. And again, the best treatment is one that has high benefit and low risk. And that's what all these machines do. The Exomind, the Emsculpt Neo, the Emsella, there's very little risk to it. And it's one of those treatments that you do the treatment and then you walk out of the office. There's no downtime. I mean, how many things can you say that for modalities in medicine? I mean, it's amazing. And again, it's just about finding someone in your office that also, nearby that knows how to use the machines too, right? Luckily, a lot of it is AI driven, so it's not operator dependent because the machines are so like clinically tested and they're already programmed to work the way they're supposed to work. It's really so easy to get benefit from it. And I wish everybody could do it, honestly.
It's amazing. I can't believe we've been talking for 50 minutes. We didn't even get to go back to the hormones.
Oh my God, I can't believe that.
We need another part two with Dr. Melinda.
Part two with Dr. Melinda. But Dr. Melinda, for our listeners who want to learn more from you, maybe do a telehealth consultation if they're not in San Diego, please tell them where they can find you on social media. Do you have a website?
Yes, I like simple. So if you remember my name, is drmelindasilva.com, drmelindasilva.com, and my IG is @Team Silva MD. And it would be my privilege to take care of any of your listeners. And I hope people take that action to do self-care, please, ladies.
Yeah, you guys, midlife doesn't have to be a decline. It can be an opportunity to optimize and to make things better. Dr. Melinda, it was a pleasure to have you on the show. You gave us so much to think about, and we will definitely be reaching out for part two because I want to talk more hormones, peptides.
Yes, thank you so much. I appreciate it.
All right, guys, until next time.
Bye-bye.
Yeah.